Presenting finances to patients is what happens after you've gone over the treatment plan with the patient. This video is for you if you're the owner doctor who presents their own finances to patients, or if you're a treatment coordinator or any other front desk personnel who's responsible for presenting finances to patients. Or if you're a treatment coordinator or part of the front desk personnel team who may be responsible for going over financial options with the patients. Before you do this step, it's assumed that the provider, meaning the doctor and or the hygienist, has gone over the importance of the clinical procedures you've presented to the patient. If you haven't seen the video on how to present treatment to patients, I've posted a link below this video. So instead of focusing on a bunch of theories, I'm just going to show you how I do it in my own practice. I present my own finances to patients because I don't have a treatment coordinator or another front desk personnel who is dedicated to this job. So, I'm not a guru in presenting finances. However, I'm just going to share with you what works in my practice and what doesn't. So I'm going to start with a smaller treatment plan that includes full mouth scaling, some basic restorative, and crowns. So for example, here's a treatment plan in open dental. Now remember, you don't have to be using open dental to follow along with this video, but you can apply these same concepts to whatever scheduling system you use in your practice. By the time I'm ready to present finances, I'm going to make, like I mentioned earlier, I'm going to make certain assumptions. First, I'm going to assume that you and your team member have gone over the clinical importance of the treatment and the risks of not getting it done. Second, if the patient has insurance, the insurance has been verified for this patient and the correct insurance verification information is attached to that patient's chart so you can estimate the out-of-pocket for that patient correctly. It's also going to be important to have the order of the treatment in correct sequence, okay? I'm not saying you should have the next 2 years planned out, but you should have at least the first few visits listed out on the treatment plan. In this example you're looking at, the first visit is a full mouth scaling. Since I present in the operatory, I make sure I have the patient seated up and I have the treatment plan pulled up on a monitor that they can see right in front of them. You can also do this on paper, or if you're using like tablets or iPads, whatever works for you. So at the first glance of this treatment plan, the patient has no idea what they're looking at. Their eyes may go towards this clinical terminology, which if you haven't mentioned during presenting treatment, they probably have not heard of. Then you've got these 3 or 4 columns of just dollar amounts and fees. So they're probably going to get overwhelmed. Then they're also going to see some insurance terminology on this treatment plan, maybe deductible that's mentioned on there, or maybe insurance maximums, etc. So my goal is completely divert their attention away from these details and get them to focus only on few things they care about. One, what's going to happen in their next appointment and what their out-of-pocket is going to be at that visit. And second, what they can expect to pay overall. Now, maybe for the first phase of the treatment plan, especially if you're breaking down the entire treatment plan into phases. As I'm pointing to the treatment plan, I'm going to point towards the clinical terminology that's there and kind of explain it in layman's terms. And also remember, I've already done this before presenting finances during treatment planning. So they're already kind of familiar with the layman terms that I'm mentioning. Now I'm basically associating it with the clinical terminology they see on the treatment plan. So for example, I'll say things like, for your first visit, for the deep cleaning that we need to do to remove the gum infection, your out-of-pocket is going to be so-and-so. And the deep cleaning, as we mentioned earlier, is what you see on the treatment plan listed as periodontal scaling and root planing. The composites are your white fillings that we talked about earlier that need to be placed to remove decay under your old fillings. If there's a core buildup and a crown listed on the treatment plan, I don't say something like, well, your core is this much and your crown is this much. I basically combine the fee for both into one. This is what I'll say. For the cap that needs to be placed in the upper left area to prevent further fracture and to prevent the root canal, your out-of-pocket is going to be so-and-so. So let's pause here. You're probably wondering, what about insurance plans downgrading, white fillings to silver fillings or all ceramic crowns to cast metal crowns? Yeah, I know there are plans that cover composites to the first bicuspid and then not on the second bicuspid, and then they're only downgrading ceramic crowns to cast metal crowns only up to the first molar and not on the second molar. I never get into these details. By getting into these details about downgrades, you're actually confusing the patient more. Put yourself in the patient's shoes. Your patients are still trying to process the information you've been going over with them in the past few minutes. First, the presentation of the treatment plan, now the financing of that treatment plan. Now you're introducing nuances and details of their insurance plan and explaining to them why their out-of-pocket is different on one tooth versus another, or why their out-of-pocket is different for a 2-surface filling versus a 3-surface filling. It does not matter to the patient as much as you think. You think by giving all these details, you're helping the patient understand about how much all of this is going to cost. It's actually the opposite. Even after simplifying this entire treatment plan like we've just discussed, some of these patients are actually going to forget what they're coming back for in their next visit. as you're coming close to the end of the financial discussion with your patients, you do want to mention to the patients that whatever we've discussed is an estimate of what the insurance will pay. And ultimately, they're responsible for anything the insurance doesn't cover. We also let the patients know that if there's an overpayment from the insurance, there will be a credit left on the account, and we do process all refund checks to patients by the end of the month. We say this in my practice because during insurance verification, we no longer get details. We just don't care for the details on downgrades on fillings and crowns. We always just assume there's going to be a downgrade on fillings and crowns. Okay, so if the insurance ends up not downgrading, there's going to be a credit left on their account whenever that claim is paid. Always remember, it's better to have credits on their accounts instead of balances. By having patient balance, you're increasing the work for your team by chasing the patients for balances with phone call follow-ups or sending out statements. Except for rare occasions, statements never need to be sent to patients. All right, let's look at an example of a larger treatment plan. How do you approach presenting finances to patients who have a larger treatment plan, which may involve insurance and out-of-pocket maybe in the range of 5 to 10K? I'm going to skip examples of like full mouth rehabs, like all on X, or full mouth crowns, because for most of us, it's not very common. I'm going to focus on a treatment plan with basic periodontal work, simple restorative, few implants, few root canals, and few crowns. And I'm also hypothetically going to assume that, let's say the patient has insurance and their maximum is $2,500 per year. When I present finances to patients like this, I always try to get an idea of how motivated the patient is in moving forward with their work, regardless of the insurance dollars remaining on their plan. Because if the patient is seeing you in January and their plan renews next January and they have about $2,500 maximum per year, there's only so much you're going to be able to do if you only focus on what the insurance will cover. So here's my process when I'm looking at a large treatment plan. Remember, you can change this to what you feel comfortable for your patients, and your approach may be different for each patient. Number one, keep it simple and break it down. Before you come to this point of presenting finances, you've already ordered the sequence of treatment after discussing it with the patient. So once I've decided with the patient what needs to be focused on first, I've already arranged the treatment in phases. So for example, phase 1 may cover everything we need to focus on until end of this year. If I do it this way, I'm better able to give the patient estimated out of pocket considering whatever's on their plan plus their out-of-pocket responsibility. So why do I break it up? Because if you're going to try to give the patient some sort of estimate of their out-of-pocket for the entire treatment plan, whether it lasts this year, it carries over into next year, because the insurance is going to max out in the middle of the year, your estimate will not even be close to what you're giving them, because now the insurance stops paying once they've reached their maximum. And what about if something changes in the middle? Okay, that big filling turns into a root canal and now needs a post and a crown. Now you're going to be eating up most of the dollars of the insurance. And what if the tooth you're actually trying to save fractures and now it needs an extraction, bone grafting, and an implant? So now your entire treatment that you gave in the beginning is going to change entirely. So you want to keep things simple, not only to help the patient understand what's coming up next and they're out of pocket financially, but also to keep it simple for your team to understand what's going on and explain financials to the patient. Number 2, focus less on the insurance restrictions and more on the risks of not moving forward with treatment. Even if the patient decides to go above the insurance limitations, I don't really focus on the fact that the insurance only covers $2,500 for the year and then they're going to end up paying the difference. If you're following each line item on the treatment plan after the insurance is maxed out, and if you're pointing out the fact that for each line item they're actually paying more because the insurance is maxed out, you're constantly reminding them that they're actually paying more than they should. And you think you're helping the patient by giving them all these details, but you're actually overwhelming them and actually making them more hesitant in moving forward with treatment. So what I typically say to patients is, while I'm looking at the entire total for phase 1, the maximum we can expect from insurance is this much, and your out-of-pocket is going to be this much. Then I remind them of the risks of not moving forward, which I already discussed earlier during their examination, and say to them, having discussed the risks of those teeth that may fracture, and if this fits your budget for the rest of the year, I'd recommend moving forward ASAP with your next appointment. Once we've gotten close to finishing of phase 1, we can start the discussion of phase 2 to maximize the insurance reimbursement and minimize your out-of-pocket. This way, again, I'm focusing less on the insurance limitations and helping them understand that we can work with them by breaking up the treatment in phases. Number 3, allow for flexibility. Of course, we want all of our patients to move forward with all of their treatment ASAP. But in reality, every patient is different. I can best explain this with the diagram below. And this is true for my practice. In my practice, about 10% of the time, patients will only do what the insurance covers. And they'll wait, for example, next 8 months until their plan renews to do the next stuff. 75% of patients end up doing both. Once they've understood that the teeth at risk need to be dealt with right away, they'll move forward with treatment even if their insurance maxes out in the middle of treatment. But then they'll wait on certain things until the plan renews next year to minimize their out-of-pocket and maximize their insurance reimbursement. So for example, let's say a patient needs 4 root canals. They'll do like 3 out of the 4 root canals. And of those 3 root canals, if they need 3 crowns, they will do 2 of those crowns. And one of them I'll close out with a post and core and carry the crown into next year to minimize their out-of-pocket and maximize their insurance reimbursement. And then there are those patients that fall into the 15% of all cases that move forward with everything regardless of their insurance limitations. Number 4, do not rush the financials. If you're the doctor and you're presenting your own finances, you do not have to present treatment and the finances at the same visit. In my practice, I don't always present treatment and the financial arrangements for the entire treatment plan in one visit. There are times I split it up. Whatever I've discussed, I break it up into phases and give them a summary. And the only thing I let them know is what they're going to be responsible for at their next visit, which, if a couple of days or weeks away, gives me enough time to put together a customized treatment plan and financial arrangements. If you haven't yet seen my video on financial arrangement and treatment planning, I go over in detail how I approach patients with larger treatment plan, especially if the treatment involves multiple visits. Make sure you watch that video, and I've posted the link below this video. Payment options and financial policies. Now that you've gone over the cost, it's time to go over your financial policies and offer payment options to patients and have them sign off on any agreement forms you may have. For financial policies, I'm referring to things like, when do you collect copays from the patient? Do you collect it at the time of service, or do you wait for the insurance to pay on the claim and whatever balance remaining, then you send a statement to the patient? What happens when a patient has dual insurance? When do you collect copays when patient is covered by more than one plan? What happens when a patient's insurance plan terminates in the middle of treatment? You may be offering third-party financing through Care Credit, for example, or you may be offering in-house payment plans or prepayment discounts. Whatever it may be, you need to have it all on a simple financial agreement form and have the patient sign off on this agreement form on how they plan to arrange payments for their care. Instead of going into detail in this video, I strongly recommend you watch the video on financial policy and agreement forms, in which I go over details on what financial arrangements you can offer, different payment options you can offer, the things you need to watch out for to minimize the money owed to your practice. Presenting financial policies and payment options is always done at the front by my treatment coordinator. I can present the treatment plan and the cost in the operatory, but discussion of financial policies and options is always done at the front. Let's talk about scheduling the appointment. Once I've gotten to the end of the treatment plan, I'm listening carefully and I'm observing their body language to see how they respond. Without asking an open-ended question to which they can easily answer with a yes or no, I immediately focus on the next step, which is to make their next appointment for the work they need to come back for. I turn off the monitor that's in front of them and then turn towards the monitor behind them at 12 o'clock position. And I basically give them 2 options for their next appointment. If those options don't work, then I ask them their schedule and make the appointment accordingly. So depending on your schedule, I have either Tuesday morning next week or Thursday afternoon. You let me know what works for you and we'll move forward. This should be done regardless whoever is doing the financial presentation. If your treatment coordinator is the one doing the treatment plan presentation, the cost and the financial options, they need to make sure there's an appointment set up for that patient to come back for work. If for any reason the appointment is not set up for the patient to come back, always ask for permission when you can call that patient to follow up with them to schedule their appointment. All right, so we've covered a lot of details here. Always remember, if something isn't working in your practice, you need to become aware. But to find out what's not working, you need to do it enough times, and then you're gonna change how things work over time. All right, so some quick tips to summarize what we've discussed so far. Keep your treatment plan simple. Break it up if you have to. Don't confuse the patient. Don't offer a gazillion financial options. Offer few that are simple for your team to manage. And remember, always close your presentation with patients by scheduling their next appointment. And if there isn't an appointment set up, always remember to follow up with that patient to schedule that appointment. That's it for today, and we'll see you next time.